Hi, I'm Vickie McDonough. I have Sjogren syndrome, and this channel is Living with Sjogren syndrome. And I hope that you will join me for a Q&A. There have been many comments from individuals sharing their stories, their struggles, their tips on coping and treating dry eye and skin issues, and many tips on dietary changes that they have greatly benefited from, even to the point of being in remission. And today I wanted to share with you all about the questions and the answers. This behind me is Netflix fireplace. I like it. There's no warmth coming off of it, but it just gives me a warm feel when I'm sitting in my little happy spot upstairs. I also have a little space heater next to me. It makes me happy. So let's get into the question. Here we go. Comment questions. How do you deal with dry mouth? I struggle. Some of the tips have been xylitol mints, regular sips of water, and there are also sprays that you can get from prescription. I believe they are prescription strength, but then there's also sprays that I have seen on Amazon. I don't use the spray. I use constant sips of water. I use dry mouth, little small dry mouth candies that are sugar-free. Even those do tend to cause a problem for me though. But the best thing I do is constant sips of water. And something that I am going to try is a little bit of coconut oil on my tongue. Let's see, did I start with blurred vision? I did have some blurred vision early on, just a little bit. I noticed that when this was in Arizona, it was pretty dry there, and I noticed that I just couldn't see quite as clearly when driving. My eyeglasses prescriptions were not changing quickly. So all I can really conclude in hindsight is that I did. Was my lip biopsy done by a dentist? My lip biopsy was done by an oral surgeon. I was referred to an oral surgeon. And it went really well. I don't remember it being bad. I just remember being super numb. It was the numbing shots that really kind of hurt more. And then afterwards, after the swelling went down, I could feel the little stitches in there, which I had to go back to get removed. I don't know if it was 5 days after or 2 weeks. It was such a long time ago, it's hard to remember, but definitely it was done by an oral surgeon. Remember that. And it was also done 23 years ago. Wow. It was nowhere as bad as having teeth removed. I can definitely say that. So I definitely recommend an oral surgeon. Let's see, how long have you been diagnosed? 23 years. My mouth has been dry since I started to talk. Normally I don't drink anything fizzy because of the way it affects my esophagus and my stomach and intestinal tract. But my mouth is so dry, and this is kind of, the fizzy bubbles are loosening up some of the dry junk. So I guess that's another way that I cope with dry mouth. Have I tried LDN? No, I haven't. Since I had to stop my Plaquenil due to early eye damage, I have not been on but 2 medications. The 5 milligrams of prednisone in the mornings and the 20 milligrams of methotrexate once a week subcutaneously by injection. I do feel like I need something in addition. to that. And so on my next rheumatology visit, I'm going to ask about LDN. All right, how has methotrexate helped me? Well, I think I should start by saying how it's helped me, but also how I feel that it hasn't helped me. Methotrexate has, let's see, I've been taking it now since early 2018. And I feel that it has helped some with my fatigue, the chronic fatigue, although it has not prevented flare-ups of fatigue that last a few days to a couple weeks. Methotrexate has reduced my overall inflammation, systemic inflammation, although it has not changed at all my SSA and SSB values. And that was as measured a full year ago. I don't know what they are now because I haven't been tested again, probably on my April visit. It also has not changed at all my ASAA value and my ASAB value. Those are sky high. It has been reduced, but they're still sky high. So that hasn't changed at all. Every time it gets measured, every single year, it's very, very elevated. I don't know if those values are something that ever changes for someone with an autoimmune disease, or if they definitely go down once you're in remission. I don't know, but methotrexate definitely has not put me into remission. I have heard that it has put some people into remission. I do believe that I'm better off taking it than not. I have better days because of it, and I have those better days more often. Although I do have my bad days, and sometimes they last several days in a row. Yeah, so it's helped me maybe 50%, and the other 50% is just not so great. So it might be beneficial for me to ask my provider about the LDN. Do you also have fibromyalgia in addition to Sjogren syndrome? Yes. I don't know if I have a true official diagnosis for every visit, fibromyalgia every time it's on there. I have had a neurologist maybe 3.5 years ago, I think it was 2019, who said everything that I'm going through is all 100% related to my Sjogren syndrome. But my Sjogren syndrome has also gone systemic, and it has been affecting my central nervous system. And I think that fibromyalgia is related to a nervous system cause. I'm not positive on that. I have not read the latest findings, research or study findings. How do you feel diet plays a role with Sjogren syndrome and autoimmune disease? I believe that it plays a huge role. I have understood that it has played a role for a few years now, but I never truly understood quite how big and intense a role that diet plays. With the comments section being filled with so many dietary experiences and changes in exactly what some people eat and don't eat, it was so eye-opening that I'm convinced. It's so powerful and plays such a huge role that it can put a person into remission. So I am amping up my dietary efforts. And I have to say that my diet throughout most of my life was very poor. But I can see that years of that inappropriate diet really did hurt me, probably made it worse. Next question. What caused your insomnia and how do you cope? I believe that Sjogren syndrome caused my insomnia, and I've had it absolutely for years. In the beginning, I thought it was anxiety because a lot of it would occur during my, my college. I went back to school as an older adult, but I had a lot of anxiety, test anxiety, and fear that I wouldn't pass and I wouldn't do well, and that I would have gone through all that education for nothing to just fail. It caused a lot of anxiety during the night, and I would have trouble sleeping, especially if there was a test coming up. Now, I did well in school, really well, but it was because I did nothing but stay home, go to school, take care of my kids, study. And so I did go to see a provider who put me on some anti-anxiety medication. At that time, it was Paxil, and that made a big difference in my sleep. It really did help. And I didn't have that constant anxiety all the time. I also, for a while in my 40s, started on hormone replacement therapy, HRT, for menopause. I had early menopause, and I understand now that that was probably related to my Sjogren syndrome. It could have been related to Plaquenil as well. I don't really know. But way back in my mid-30s, I did have hot flashes. They didn't happen as often, but they did happen. So there's that as well. So how am I coping with the insomnia that I'm experiencing now? I have to say it's been pretty severe insomnia, pretty constant with no let up. It has caused worsening of all my other symptoms. For a long time, I took Ambien, 5 milligrams. I've been prescribed Vistaril for it. I've taken Benadryl for it. I was also prescribed Trazodone, which knocked me out, and by morning, I would still feel so knocked out that I wouldn't even be able to drive to work, not drive safely. I would have to call in, and that's only on the 25 milligrams of Trazodone. Now, I don't think that it's like that for everybody. However, I'm easily affected by medication. It doesn't take much. But now, over the past year and a half, I changed from my primary care doctor over to a mental health nurse practitioner to manage my mental health meds. And she strongly felt that sleep was the very first thing we needed to work on and get fixed. She said, until your sleep gets resolved and you're sleeping restoratively, nothing else is going to improve or get better. So she put me on the 5 milligrams Ambien that I had already been taken, and she had me take 4 milligrams of melatonin, and then it just wasn't doing enough. And so she put me on buspirone, 5 milligrams, and oh my goodness, it made a difference as far as my anxiety. But then by nighttime, I would be anxious again and wouldn't be able to sleep. And I didn't realize that I was anxious, but I was, because thoughts would constantly roll through my head. And I wouldn't be able to shut it out. And my way of coping with that was to memorize things and just recite them. I memorized all the different countries in all the different continents by region and in alphabetical order. Now that's pretty desperate to go through all of that for sleep. I'm glad I learned those things. I'm more knowledgeable, but none of it helped me to sleep. So my mental health provider then prescribed nighttime buspirone of 5 milligram at night. And lo and behold, I began to sleep. Between the 10 milligram, when she increased my Ambien to 10 milligrams, all these little things were step by step, month by month changes. So I would say it took a total of 8 months to get me sleeping. And if I miss anything in that combination, I don't sleep. I also cope with the insomnia by limiting what I'm eating before bed. I don't eat anything past 6 or 6:30. Anything I eat, for at least within that 3 hours before bedtime is going to affect my sleep. But I can say between the limiting what I eat before bed, limiting my phone use, and using a pillow that isn't the standard rectangular poofy pillow. I use a neck pillow. It's bone shaped. It's like a big dog bone pillow. And it's narrow in the middle and it's wider out on the edges. And it's just perfect for me, anyway, with my neck issues. It just helps me relax. But definitely that combination of medications is what really got me sleeping. I lost my fireplace, had to fix it. So those meds again are 10 milligrams Ambien, 5 milligrams buspirone, and 4 milligrams of melatonin. And there are times when I do have to take about 400 to 600 milligrams of ibuprofen if my neck and my muscles are bothering me. That's also another thing that would keep me from sleeping is pain. Let's see, next question. Do the meds make me have flushing or excess sweating? I have flushing and I have excess sweating when I'm up doing some chores. I don't know if it's from the medication or from my Sjogren's or from my age or my low estrogen level. It's probably a combination of all of that, although it happens a lot more now that I'm on methotrexate. I would have to say yes to that one. So that is it for the Q&A. There are many stories, tips, and recommendations in some of the different videos as well. And so I will follow this up with another video about comments and talk about all the wonderful tips. And I'm greatly appreciative of all the comments. Thank you so much for hanging out with me with this Q&A. And I hope and pray that you all will be able to stay well and feel better. Love to you all.